Hello everyone. Today, we're exploring the medication Ketorolac, commonly known by its brand name, Toradol. As always, this discussion is for educational purposes. For any health-related queries or concerns, please consult a healthcare professional. Description: Ketorolac, also marketed under the brand name Toradol, is a nonsteroidal anti-inflammatory drug, NSAID, available in oral, injectable, and ophthalmic forms. It is primarily used for the short-term management of moderate to severe pain, typically after surgery. Unlike many other NSAIDs, Ketorolac is renowned for its potent analgesic properties, which are comparable to opioids but without their potential for dependence. However, due to its risk of serious side effects, particularly related to the gastrointestinal tract and kidneys, its use is generally limited to 5 days. Ketorolac can also be used to manage pain from other acute, severe conditions, as prescribed by a doctor. Warnings: Ketorolac carries significant risks if not used as directed. It is not suitable for individuals who have recently undergone or will soon undergo coronary artery bypass graft surgery. People with peptic ulcers, active gastrointestinal bleeding, or a history of gastrointestinal problems should avoid this drug due to the increased risk of bleeding. It is also contraindicated in patients with advanced renal impairment and those at risk for renal failure due to volume depletion. Additionally, patients with known hypersensitivity to NSAIDs or Ketorolac itself should not use this medication. Before taking this medicine. Before beginning treatment with Ketorolac, it's crucial to discuss your medical history with your healthcare provider. Inform your doctor if you have any conditions such as asthma, coagulation disorders, dehydration, or high blood pressure. Pregnant or breastfeeding women should consult their healthcare provider due to potential risks to the fetus or infant. Also, inform your doctor about all other medications you are taking, including over-the-counter drugs and herbal supplements, to avoid adverse drug interactions. You should not take Ketorolac if you are currently experiencing or have a history of gastrointestinal bleeding, peptic ulcer disease, or severe kidney problems. Also, avoid Ketorolac if you are allergic to aspirin or other NSAIDs. Side effects: Common side effects of Ketorolac include gastrointestinal problems such as nausea, vomiting, indigestion, and diarrhea. More serious, though less common, side effects can include severe gastrointestinal bleeding, liver toxicity, renal impairment, and increased risk of heart attack or stroke. It is also possible to experience allergic reactions, such as hives, difficulty breathing, and swelling of the face, lips, tongue, or throat. If you experience any serious side effects or signs of an allergic reaction, seek immediate medical attention. Interactions: Ketorolac may interact with other medications, which can lead to enhanced effects or serious adverse reactions. It is known to interact with anticoagulants, other NSAIDs, steroids, selective serotonin reuptake inhibitors, SSRIs, and diuretics, among others. Always disclose all your current medications to your healthcare provider to prevent harmful interactions. Dosage: The appropriate dosage of Ketorolac may vary depending on the form, tablet or injection, and the individual's condition. For adults, the typical starting dose is 10 mg every 4 to 6 hours for tablets or a single intramuscular injection of 60 mg for moderate to severe pain. The maximum daily dose should not exceed 40 mg in tablets or 120 mg in injections to minimize the risk of side effects. Always follow your healthcare provider's instructions precisely and do not exceed the recommended duration of treatment. Avoid: While taking Ketorolac, it's important to avoid alcohol, as it can increase the risk of stomach bleeding. Patients should also be cautious about using other NSAIDs concurrently, as this can increase the likelihood of adverse effects. Due to the risk of dizziness and drowsiness, avoid driving or operating heavy machinery until you know how Ketorolac affects you. FAQ: A common question about Ketorolac is whether it can be used for long-term pain management. Due to its side effect profile, Ketorolac is only approved for short-term use of up to 5 days and is not suitable for chronic pain conditions. Closing: This concludes our overview of Ketorolac. Remember, this information is intended to be educational and should not be used as a substitute for professional medical advice. Always consult with a healthcare provider to address any questions or concerns you may have. Thank you for joining today's session.